Hello everyone, my name is Blessing Okereke, and today I'll be presenting on my disease of choice, which was gonorrhea. So what is gonorrhea? Gonorrhea is a sexually transmitted disease that is a bacterial pathogen and is caused by the bacterium Neisseria gonorrhoeae. It is usually found in age ranges 15 to 24, but anyone of any age range can actually be infected by this disease. So gonorrhea infects the mucous membranes of the reproductive tract, the mouth, the throat, the eyes, and the rectum of both men and women. Humans are actually its only reservoirs we have found. So for history and other names, gonorrhea has two nicknames, one being the clap and the other being the drip. So the clap comes from a French term, les clapiers, which were brothels back in the day where gonorrhea was widely spread. And it was actually thought that women were the cause of this disease. But as time has went by, we have found that both men and women are equally susceptible to be infected by gonorrhea. The second reason was because a treatment back then was where physicians would take a book and beat or clap the genitals, the infected genitals, to remove the discharge that was green or yellow in color that was spewing from said genitals. And then you have the drip, which is a little self-explanatory now. And it's because when the areas get infected with gonorrhea, a pus-like discharge or the green or yellow discharge that I mentioned earlier will start dripping from those areas that are infected. So yes. Fun fact, gonorrhea actually is said to be the oldest STD, and that is because we have accounts dating back from 2600 BC from a Chinese emperor by the name of Huang Ti. And he writes accounts of a disease that causes unwanted discharge in the genitals amongst his subjects, which we can now say, or safely say, is gonorrhea. But it wasn't until 1879 that a German physician actually discovered the bacteria that causes gonorrhea, which he then named Neisseria gonorrhoeae. So he named it after himself, Albert Neisser. Okay, so for the taxonomy, bacteria is the kingdom, Proteobacteria is the phylum, Beta Proteobacteria is the class, Neisserialis is the order, Neisseriaceae is the family, Neisseria is the genus, and Gonorrhoeae is the species. So for characteristics of gonorrhea, it is aerobic, is gram-negative, is diplococcus, non-motile, tests negative for endospores and acid-fast. It has no flagella. It is positive for oxidase, catalase, nitrate reduction, and has fimbriae. The incubation for gonorrhea is 1 to 14 days, but we have seen that patients usually start experiencing symptoms from days 2 to 5 after exposure or infection. So a quick overview of pathogenesis. Um, Essentially, the gonococcus is spread into the vagina and makes its way to affect the walls of the vagina and the cervix. So this starts by the type 4 pili on the gonococcus allows the bacteria to grab onto the walls of the vagina and form these microcolonies on the epithelial cell surfaces. Then a white blood cell will spot it because it is a foreign substance, and then swallows it using its OPA receptors. Usually, when white blood cells do this, it is because it will then process the proteins within the bacteria to develop antibodies, um, so that, the next time we are infected with said bacteria or said infection, we have resistance towards it, or which is known as immunologic memory. But with gonorrhea, the interesting thing is that humans actually cannot build immunologic memory towards it because gonorrhea has what is called OPA proteins that block the OPA receptors from the white blood cells from doing their jobs essentially. and stopping them from working. So this is why people can go their entire lives and have or and be infected by gonorrhea multiple times. So for symptoms in both women and men, um, they're actually very mild, and that's why, at least for women, they are often misdiagnosed with bladder or vaginal infections instead of the actual disease. But symptoms include increased vaginal discharge, that is yellow or green, painful urination, also known as dysuria, bleeding outside of menstruation, so just random bleeding, or abdominal or pelvic pain. For men, it's very similar. They also have dysuria. They also have pus-like discharge, and they actually get swollen testicles. So for these other areas of symptoms, this is for both men and women. Um, for the rectum, you have pus-like discharge and blood. For the eyes, you also have pus-like discharge, and you have sensitivity to light. When the throat is infected, it becomes sore, and the lymph nodes become swollen. In more severe cases, the joints can also become swollen and painful, and this could actually lead to arthritis. So for lips, you will get things like cold sore, which we see here. Okay, so for complications in women, if left untreated, gonorrhea can actually cause things such as disseminated gonococcal infection, also known as GGI, or pelvic inflammatory disease, PID. And this causes scar tissue that then blocks the fallopian tubes, which can then lead to infertility. And if you're trying to conceive, it can lead to miscarriage or ectopic pregnancies, which is pregnancy or which is where the child is growing outside of the womb. And then for men, you have something called epididymitis, which is an infection in the genitals that can also lead to infertility. A question that is often asked is whether gonorrhea can be passed on to the child if a mother is pregnant and is infected. And the answer to that question is yes. And this is because when the child is being born, the infection can pass on to the baby during delivery, because the birth canal actually becomes a breeding ground for the Neisseria gonorrhoeae. Um, and so this leads to the child having a greater risk of childhood blindness, or the amniotic sac and fluid being infected, or you could have preterm birth, or something called PR or PPROM, which is preterm premature rupture of membranes. Or even when the child is born, they can have joint infections and life-threatening blood infections. But this can be all these symptoms, the likelihood can be reduced if, again, the mother is diagnosed quickly and given proper treatment. So for diagnosis, the primary way, or the only way really, is through urine sample or a swab of the infected area. And this is the urethral for men and the vaginal or endocervical for women. And then the swab, or like the swab of the infected area, can actually be put through a petri dish. The specific petri dish would be the Thayer-Martin petri dish to see if the bacterium culture grows. And if it does, then that means that Neisseria is within the patient, I guess. But another common method is using the NAAT, which is the nucleic acid amplification test. Um, and how this works is that the test runs to see if there's any DNA of the bacteria. And if there is, then that means that the patient is infected. And then patients are advised to have a second culture 1 to 2 weeks after the primary diagnosis. And the reason for this is, for one, to see if whatever treatment is being given is working, and if it's not, then during the follow-up examinations, we can determine if a sensitivity test is needed. And the sensitivity test works to identify if the patient is just having is just not reacting to the antibiotic, and then the antibiotic will be changed to something else. So prevention and treatment. Obviously, for prevention, we would say safe sex, proper usage of condoms. So follow the directions on the condom packets because people do not read those. Frequent STD testing. Also, make sure that your partner is getting tested frequently, and it is best to keep monogamous relationships. And for treatment now, we would say to go by go by dual treatment. That is what doctors recommend nowadays. And this is essentially taking two different medications because usually when a patient is diagnosed with having gonorrhea, it is assumed that they also have another STD, which is usually like chlamydia. And so they are given one dose of the 500 milligrams of uh, ceftri- uh, ceftria, ceftriaxone, or in conjunction with the cycline, or the azithromycin. But it is also recommended that there's a retest 3 months after the initial treatment. And another reason for this is because we are now running into the problem where a lot of people are having a harder time being cured of gonorrhea because the body is becoming resistant to these antibiotics that are being used to fight the infection. But really quickly, I wanted to talk about previous treatments that I thought were really interesting. In the 1940s, it was actually thought that because of the development of penicillin, that this could be used as a cure to fight off gonorrhea or to cure patients from gonorrhea. But it was actually found in 1980s that the virus Neisseria gonorrhoeae was resisting penicillin, which is then why they actually had to move on to another antibiotic known as spectinomycin. But obviously now we ended up on ceftriaxone. So, but yeah, that is the end of my presentation. I hope you enjoyed it and learned something. Bye.